The first and foremost of the lessons is to what I call, when you're dealing with an emerging outbreak, to expect the unexpected. Because if you have not had experience with a particular pathogen, the rules that you've learned from other pathogens may not apply. For example, if you look at the original emergence of COVID, it was felt to be treated very similar to how we would treat influenza, where you would have the burst of activity. At the end of the season, it would go away, and that would be it. That's exactly what did not happen with COVID. We had multiple waves of different variants within the same outbreak. That's completely unprecedented with a respiratory illness, to have multiple waves in the same outbreak. That protection against the original virus does not help you to be protected against what the next wave is. We didn't expect that. Number two, the classical paradigms of how a virus is spread were turned upside down with COVID. For example, with influenza, a very small proportion of people get transmitted when they don't have any symptoms. With COVID, 50 to 60% of all the transmissions occur from someone who has no symptoms at all, either will never get symptoms or is in the pre-symptomatic phase. The other was a lack of appreciation of aerosol spread as opposed to droplet spread. Bottom line, when you're dealing with a new pathogen, always expect the unexpected. Next thing is you have to have very clear communication and collaboration throughout the world. There has to be transparency so that every country knows exactly what's going on in other countries. We didn't have that in the very early weeks of the outbreak from China, and it would have been very helpful if we knew a lot more about the virus in those first weeks to help us prepare. Another thing that's important is that the investment that you make in basic and clinical biomedical research prior to an outbreak plays a critical role. The example with COVID is a very compelling example. The work that was invested in basic research 10, 15, 20 years before COVID allowed us to develop the mRNA technology, which was transformative in our ability to make a highly effective vaccine. The structure-based immunogen design to get the proper stabilized immunogen allowed us to do something that was completely unprecedented, to go from understanding the sequence of a virus to getting a safe and effective vaccine into the arms of individuals, which has saved millions of lives. We did that, we being the scientific community, in less than 11 months. That is completely unprecedented and likely resulted in saving millions of lives. The time frame historically from when you get a pathogen that you recognize to the time you get a vaccine is somewhere between 7 and 10 years. So you can imagine how bad off we would have been if it would have taken 7 years to develop a COVID vaccine. The other thing that we've learned that's really, really very important is that you have to be prepared right from the get-go to move quickly, because when outbreaks occur, they don't occur linearly, they occur exponentially. What you see today is likely something that went on a couple of weeks ago, and what's going on today will express itself weeks from now. So you've got to move very, very quickly. The other thing that we learned is that the disparities, at least in the United States, it was very clear that inequity to the access to health care and interventions is a very strong factor in leading to the deaths and hospitalizations, because in the United States, we didn't have an equal accessibility. There were people either economically who were deprived or people who were ethnically and racially discriminated against, who didn't have the access to the kinds of health care that were needed. Those people disproportionately suffered more from the hospitalizations and deaths of COVID. Another thing that we learned is very important, and this is really critical, is that misinformation and disinformation is the profound enemy of public health. And I know we've seen it in the United States. I'm sure there was a bit of it in France, but it was very powerful in the United States. The amount of anti-science misinformation and disinformation led, in my mind, to many, many unnecessary and avoidable deaths. For example, the idea of getting vaccinated or not. Because of the divisiveness in society, in my own country, if you were of one political persuasion, namely a right-leaning Republican, you were less likely to get vaccinated than if you were more of a center or left-leaning Democrat, you would wind up getting vaccinated. And when you do the modeling, it is estimated that anywhere between 150,000 and 200,000 people died because they refused to get vaccinated based on misinformation and disinformation. So those are just a few of the lessons that we've got to make sure we learn and don't forget. It's very, very easy once you get past the problem to put it in the rearview mirror and forget about it. But we have to realize that, first of all, pandemics have been with us before recorded history. We've had major pandemics like the 1918 influenza pandemic. We've had HIV. We've lived through COVID. It is without a doubt that there will be more pandemics. So the final lesson that you learn is because pandemics and emerging infectious diseases are a perpetual challenge to us, we've got to make sure that we are perpetually prepared. And that's the final and most important lesson.